Good afternoon. We have many distinguished guests here. I will be exceedingly brief. You've heard already about the rate of growth of healthcare costs. I brought you a picture, and this shows you what is called excess cost growth. It's the excess of the rate of growth of per capita healthcare costs in the economy over the rate of growth of the GDP. That is the excess of cost growth of the cost of the healthcare system over the income out of which it can be paid. Right now, that margin is about 1.5 percentage points. It is driving a growth of total healthcare costs in the economy from 5.2% in 1960 to 16% in 2006 and to a projected 20% in 2015, growing without apparent limit. To be sure, we all know that healthcare costs will not grow to be 102% of the GDP because they can't. As former CED economist Herbert Stein once said, if a process cannot go on forever, it will stop. But we also see no current force that is limiting that growth. So the concern is how the process will stop, not to mention the damage that it will cause until it reaches its limit. Now, excess cost growth is often referenced with respect to the federal government's programs, Medicare and Medicaid. But as the chart shows, excess cost growth applies to all healthcare costs, government and businesses and individuals who must pay their own way through insurance or provider bills. The situation of employers is extremely important to healthcare coverage. It is also dire. Most insured Americans still get their coverage through employment, either their own or a family member's. But the number and percentage of healthcare costs that is paid by individuals and by businesses has been growing, more than doubling in the last 8 years. And as a result, you can see in this chart that the number of Americans under age 65, that is those who are not eligible for Medicare, who have employer-based insurance, has declined over the last 8 years, the absolute number, while the population in the same age bracket has been growing by 20 million people. So it follows that the share of the population that is covered has been declining as well. The reason why costs have been, coverage has been flat is because costs have been growing. And you can see from this chart that costs of insurance premiums, both employer and employee, have more than doubled over the last 9 years. And that is a special burden on low-wage workers, and in fact, the typical cost of a family insurance policy right now is virtually equal to the year-round earnings of a minimum wage worker. But even such a sharp increase in premiums understates the increase in cost to workers and the ultimate burden on people. Employer coverage is not what it used to be. In addition to the decline in the frequency of coverage is a decline in the quality of coverage. Even for those who have coverage, there are large deductibles, as you can see here, growing, and larger copayments. Some employers are cutting back to cover only their employees and not their employees' families. So as bad as the premium picture looks, the reality is even worse. Even many of those working for employers who provide coverage may not get it. This can be because two working spouses choose coverage from one employer, but it also can be because the employees choose not to be covered, possibly because of cost. This picture shows that in round numbers, even for employers who offer coverage, only about 80% of their employees actually get the offer. And only about 80% of those actually take up insurance. So the bottom line is only about 65% of people who work for employers who offer coverage actually get insurance. And while the price of healthcare has been rising, the quality has been mediocre at best. Our standing around the world in the example of infant mortality is typical. The Institute of Medicine of the National Academy of Sciences reported that between 44,000 and 98,000 Americans die annually in hospitals for medical errors. A recent IOM report estimated that at least 1.5 million Americans are sickened, injured, or killed each year by errors in prescribing, dispensing, and taking medications. Drug errors cost at least 400,000 preventable injuries and deaths in hospitals each year, more than 800,000 in nursing homes and facilities for the elderly, and 530,000 among Medicare recipients treated in outpatient clinics. A 2003 RAND study found that only about 55% of the care called for under generally accepted standards of medical practice is actually being delivered. RAND studies have also documented considerable overuse of care, as have studies done at Dartmouth. So there's strong evidence that some people are getting too much health care, that is unnecessary or unhelpful care, and others are getting too little. So at bottom, we believe that cost drives coverage down. And yet all of that spending has not driven the quality of care up. So what will happen if we don't change course? Employers' payments for their employees' health insurance will become an increasing drag on business finances, including productive investment and wages, which will be especially painful in the current economy. This final chart shows that employer-paid health insurance premiums have grown about sixfold since 1960, increasing by more than 3% of the GDP, while profits have fluctuated around a flat trend. Without significant change, more jobs will be lost, including jobs moving overseas, because employers cannot afford the cost of health care. But employees' costs in the form of premium shares, co-payments, and deductibles will increase as well, slowing still further the growth of cash wages. More people will be forced out of employer coverage and onto public programs. Medicaid costs of state governments will crowd out spending on education and infrastructure. And the federal budget will be deeper in deficit because of growing costs of Medicare and Medicaid. Those workers who fall through the cracks, notably people who find jobs in new small businesses, will not have health insurance at all. Their costs will be shifted to others through poorer health with uncompensated treatment in already overstressed emergency rooms. We need to find a better way. But first, we need to recognize that this way is the wrong way. These facts tell a painful story and make clear that U.S. health insurance and healthcare delivery need to change.